On 4th of February every year, the world unites to raise awareness on the fundamental cancer issues. Between the year 2022 and 2024, the focus of the World Cancer Day is to help close the cancer gap. This year, being the third and the last year of the campaign, the theme of the year is Together We Shall Challenge Those in Power. This theme encompasses the global demands for those in power to prioritize the need for cancer prevention, care, and to also create a cancer-free world. Cancer is a large group of disease that can affect virtually all the organs or the tissues of the body, in which the abnormal cells grow uncontrollably, thereby invading the adjacent structures or even going beyond that to spread in the whole part of the body. Cancer is the second leading cause of death globally. Colorectal cancer, prostate cancer, liver cancer, gastric cancer, that's the stomach cancer, are one of the most common cancer in male, while breast cancer, cervical cancer, thyroid cancer, colorectal cancer are one of the most common cancers in women. The chances of cancer increases with an increasing age, though there are still some cancers that are attributed to the younger people. But in as much as the chances of cancer increases with age, there are still some daily life activities that can predispose us to these cancers. Some of these daily life activities includes alcohol, excessive alcohol intake, smoking, and ingestion of some of these carcinogenic substances that are mostly contained in most of these overprocessed food. So what this thing does is that it tends to cause what we call genetic mutation. So these cancers are being carried via the bloodstream through the lymphatic tissues and spreads to the other parts of the body. This process is what we know as, in the early stages, the cancer might not really have any obvious symptoms unless on incidental finding. Maybe the patient went to the hospital and some tests were conducted on the person and the person was noted to be cancerous. Most of the symptoms of cancer manifest in the later stage, and these symptoms can range from weight loss to bone pain to excessive tiredness to other vague symptoms. That is one of the reasons why it is very, very important for you to always have a regular checkup. Now, the question is, how do we prevent this cancer? The way to prevent these cancers are not far-fetched. One of the ways of preventing cancer is, one, avoid any form of tobacco use, because these tobaccos have been noted to contain some carcinogenic agents which can possibly cause which can be a mutant that will possibly cause cancer. Then number two is exercise regularly. Exercise has been shown over time to have a way of limiting the occurrence of cancer. Then the third one is avoid alcohol. Alcohol has been shown widely to cause cancer, especially the liver cancer. Because what this alcohol does is that it tends to cause the liver cirrhosis. In that way, it tends to change the genetic makeup of these cells, which will now lead to cancer over time. Then the fourth one is infections like hepatitis, HIV, and human papillomavirus. These infections have been noted to cause cancer. Something like hepatitis can cause hepatocellular cancer, HPV can also cause what we call the cervical cancer. So protecting yourself against these infectious diseases, which could include taking vaccines for the hepatitis B, taking vaccines for the HPVs, and also um, practicing safe sex can actually help to reduce the rate of having these cancers. The fifth one is staying lean or trying to be in shape, because it has been noted that obesity has a role to play in cancer predisposition. So the more you try to stay in shape by checking your BMI to make sure that you are not obese or overweight, can actually help in a way. Then the sixth one is radiations from any source, especially from the sun, or maybe from other radiation emitting sources, which could actually be as a result of the type of occupation that the person is being exposed to at that moment. The essence of this video is to help to create awareness on the type of cancers and the possible things we can do to actually help to reduce the rate of having these cancers, especially knowing the situation of the country, that our country has been plunged into severe poverty, that a lot of people cannot get proper care. A lot of people don't even have access to the healthcare facilities, and drugs are quite expensive. Normal drugs are very expensive. Then talk more of chemotherapy, which are very, very expensive. How many Nigerians can boldly afford chemotherapy without losing sweat? So if we can actually work towards prevention, early detection, then we can actually try to push on the government to see what they can do, either by subsidizing the prices of these medications, so that the common man can actually benefit, so that even if they can put up a proper health insurance system that can help and attend to the needs of the people, because a lot of people are dying out of poverty, not because they don't want the health care, but because the health care is not readily available. So you and I, we all have a role to play. Everybody has a role, because some of us are closer to the people in the government. We all have a role. Let us try to fight to see how much we can tackle this